Okay, we're recording, we're live. So good afternoon, everyone, and welcome and thanks for joining today. I appreciate people coming today as well. Specifically, we were just saying it's obviously lunchtime on one of the hottest days of the year. So thanks still for coming along. Hopefully it'll be a good session for everyone. So just some kind of quick introductions if my laptop wants to not freeze on me constantly because of the heat. So I'm Jordan Francis. I'm a public health senior officer and I lead on the delivery of the BLACHIR review within Birmingham City Council. It's great to see already in the chat such a broad mix of people with us today, kind of including colleagues from the ICS, from councils, kind of across community organisations and wider. So today, really, we're using it as an opportunity for three things. So it's first to briefly reflect on the context and the journey of BLACHIR. Second, to share the findings from the independent academic evaluation that was commissioned. And third, to look ahead, because it's not just about reviewing what we've already done with BLACHIR so far, but looking at what we take forward, what needs embedding into the way we work, and how this continues to shape Birmingham's wider anti-racism and health inequality agenda. So just as always, some really basic housekeeping points. Just if you can, just especially while there's a fair few people on the call, if you can keep yourself muted and turn off any VPNs just for the webinar section, such as kind of like NetMotion or anything like that, that will help with connectivity and audio quality, especially with if anyone's computers are being a little bit slow today, like mine. There will be a chance for people to come off mute in a live Q&A towards the end of the session, but if anyone wants to ask questions throughout, we do have both the Q&A function enabled or the chat as well, and there will be people monitoring the chat for any quick responses that we can do there. All of these slides will be shared via your email, so anyone that's signed up via Eventbrite, so there's no need to worry about capturing everything in real time, and the raw recording will be uploaded to the Healthy Brum YouTube channel in the next couple of days, ready to kind of watch on demand. A quick run through of the agenda for today. So as I said, I'll begin by setting the context, giving a short overview of the BLACHIR review for those that are not wholly familiar with the work, why this work matters locally, and why we commissioned this evaluation now at this particular time. We'll then move into the main section of the webinar where I'll hand over to Sarah and Victor from Equalital to present the evaluation findings. After that, I'll return to talk through the next steps, including a short presentation from Dr. Tanya Sikabafori, the BLACHIR ICS Task Force Chair, to talk through how the evaluation is shaping the task force going forward. And I will talk through how BLACHIR is being embedded through wider programmes of work in the council, such as via Marmot Places and the Beyond Racism work. And we'll then have some time to open up for questions and closing with some further information, links and acknowledgements. So for those who know BLACHIR pretty well, some of the earlier slides might serve as a bit more of a reminder for the broader context. For those who are newer to this work, hopefully they'll give enough background information to understand why the evaluation matters and what it's helping us to test. We won't be going through any of the BLACHIR projects in detail today, as there is lots of other information online, other webinars and other reports, but there is plenty of signposting in the presentation to our BLACHIR work for anyone that is interested in learning more about the different things going on. So with that, let's start with the context of why BLACHIR matters, what makes it distinct, and why evaluating it now is an important moment. So first, I wanted to kind of take a step back and give a bit of a snapshot of Birmingham's local context. So what I've pulled up for this slide is a granular breakdown of residents' ethnicity as per the 2021 census. And this table is a breakdown of the specific write-in options, which there was 220 categories recorded. And this is under any one that had the overarching tick box of Black, Black British, Black Welsh, African or Caribbean. And the reason I wanted to include this slide is it demonstrates something that sits at the heart of BLACHIR, that the granularity and those distinctions really matter, that too often data and policy discussions rely on very broad labels such as Black, Black African, Black Caribbean, or even historically cases such as BAME. But those groups can hide very different communities, identities, experiences, and needs. So as this slide briefly shows, Birmingham's Black populations are split not into a single homogenous group. We have large portions of the community identifying as Caribbean, Somali, Black British and Nigerian, just to name a few. And each of those categories sits with a different set of cultural, social and historical realities. The table also shows how Birmingham compares with the national picture. So overall, around 12% of Birmingham's population falls within this broader Black ethnic category, compared with around 4% nationally. So in Birmingham, it's really not a marginal amount and is a major part of the city's demographic and public health landscape. So just a quick, why does that matter? It's really because if our data is then too broad, our services can become too broad. And if these services that we have in Birmingham are designed using categories that flatten and erase differences, then there is a real risk that communities become less visible in commissioning, service design, and decision making. So it really highlights why a programme like BLACHIR is needed in a city like Birmingham, one where diversity within communities matters just as much as diversity between them. So now just to quickly understand where BLACHIR came from, it helps to just quickly take us back in time to its original purpose. So for those that are completely unfamiliar, BLACHIR stands for the Birmingham and Lewisham African and Caribbean Health Inequalities Review. It was launched as a partnership in 2019-2020 between Birmingham and Lewisham's public health teams to explore and better understand the inequalities affecting African and Caribbean communities. What made BLACHIR different from the outset was its methodology. So rather than being a traditional review or assessment carried out only within the public health teams, there was a deliberate partnership between public health, an external community advisory board, and an academic advisory board. So the review wasn't just institutions looking to diagnose internally inequalities from within their own systems. It brought together that lived experience, the community leadership, and that kind of academic side and public sector responsibility. So all in all, BLACHIR was built on these principles that if we want systemic change, we need a different kind of process to get there and achieve that. So that approach of being community informed and academically supported and system facing is important to keep in mind today for this evaluation piece, which again was not just looking at a list of activities, it was looking more at whether or not this distinct approach has actually helped create that meaningful and ongoing change that we were seeking out. The review itself identified 39 opportunities for action across 8 thematic areas and also identified 7 key priority areas for action. So those priority areas, as you can see on screen, were fairness, inclusion and respect, trust and transparency, better data, early interventions, health checks and campaigns, healthier behaviours and health literacies. So it wasn't designed to just focus on one isolated health issue or intervention in one part of the system. The BLACHIR review was designed to recognise that health inequalities are shaped by a range of structural, institutional and social factors, and that responding to them requires action in multiple places at once. So the opportunities for action and those key areas went on to shape and continue to shape a range of practical programmes and pieces of work across Birmingham over the past few years. And for anyone that wants to explore those in more detail, there is the BLACHIR web pages that provide some more detail on those key programmes. Hopefully you should be able to either click on the slide, it will be available in the presentation shared afterwards, or for shorthand it will just be www.birmingham.gov.uk/BLACHIR. So one of the most important things to understand about BLACHIR is not necessarily what it has done, but how it worked that made it distinctive. So there are kind of 3 main things that I pulled out here just to quickly recap on the slide. First, there is the long-term commitment. So as I mentioned, development of the review began back in 2019 and activity is still ongoing and driving forward with full force in 2026. BLACHIR has continued through changes in local authority structures, ICS arrangements, governance shifts and wider pressures within the system. Second, BLACHIR has acted as a really strong platform for change. So it didn't narrowly focus, like I said, on one behaviour, one campaign or one service line. Instead, we really looked at helping to build that wider infrastructure and model for change, influencing things from culture, data, training, community engagement, governance and delivery. And first, and perhaps most importantly to me, BLACHIR has been rooted in co-production and equal partnership from the get-go. So community is not sat on the outside of BLACHIR as something to be consulted on after those decisions had already been made. It's been a central part of every stage, again, through that advisory panel, through to independent co-chairs that chaired the previous governance arrangements, community organisations shaping delivery, and having people really help define what meaningful progress should look like for our residents. So it's really kind of just to highlight that if we're serious about reducing and tackling racial health inequalities, that we can't just rely on institutions speaking to and within themselves, and we have to create structures where communities have influence and power to challenge those assumptions, influence our priorities, and shape what good looks like. And that's why one of the core reasons why BLACHIR and evaluating BLACHIR is so important to me, because it allows us to test whether this approach has led to a different kind of change. Now, I didn't want to completely gloss over all of the activity and some of the brilliant work that's been done over from BLACHIR throughout the years. It was impossible to refine it down to just one slide. So this is literally such a small part of the activity and the impact to date. But some of these are highlighted as case studies in the evaluation. So I just wanted to literally talk on 2 or 3 of them to show the breadth of the BLACHIR's impact and across all the different types of interventions that have occurred. So one example that we've highlighted here is the work that University Hospitals Birmingham did on their diabetes outpatients and their do not attend rates. So through targeted engagement that they did specifically with African and Caribbean patients, they saw a 25% reduction in DNA rates. And I find this to be a really strong example of what can happen when we move away from kind of generic assumptions on why people aren't attending services and healthcare appointments and start looking carefully for who the services are working and not working for. A second example to pull out is the recent vaccination campaign developed by one of our community partners, Ilera Health. So it managed to reach dozens of GP practices, pharmacies, and buses in Birmingham, and has since expanded into a recent MMRV campaign work with local schools. There is kind of a strong localized and personal feel to campaigns like this. I know that there was an example when I was talking to the community organisation that led this, that they went into a pharmacy, asked if someone recognised the campaign materials, and they went, "Oh yeah, that's my brother." And it was a really nice moment there, and it really kind of showed BLACHIR's ability to not just work exclusively in those clinical settings, but also through those public-facing community-linked channels. I also wanted to briefly mention a piece of work directly speaking to system change, and that is our ongoing culture, humility and safety training and culture and intelligence framework packages. So with culture, humility and safety, we've had over 500 staff trained across Birmingham City Council and integrated care system partners. And there is now kind of an ongoing process to look at expanding that out to our corporate leadership team and councillors or cabinet members. So really driving the kind of themes around culture, privilege and identity right up to the top of our systems. And also some of the specific culture intelligence training, again, delivered by our community partners, that over 250 staff so far have received community specific culture intelligence training to really help service planning and service delivery. So just to kind of briefly show that BLACHIR has informed both those practical interventions, service improvement, workforce development and organisational change. But equally, all of these activities, despite being great independently, raise kind of that deeper question on how far has BLACHIR changed the system around them. And that's where this evaluation becomes important. So finally, on to the rationale for why we have decided to commission out an evaluation. As with any long-term programme working across multiple organisations, the context around BLACHIR has continued to evolve. And like I mentioned, governance structures have changed, partnerships have developed or altered, and the way that the work is held within the wider system has shifted over time. But regardless of that wider change and BLACHIR still holding strong, like I've mentioned a couple of times, there's still that question of, is this working? Is BLACHIR working? And by that, I say we're not just meaning, has there been good projects? Is there something more fundamental around facilitating purposeful and ongoing systemic change? Has it created the conditions needed for institutions to respond differently? Has it strengthened any of the accountability, collaboration, or anti-racist practice and community voice in ways that are lasting? There's a need to demonstrate this ongoing commitment to tackling racial health inequalities and embedding the learning from BLACHIR. And there's also a need to build a strong evidence base about why this kind of work matters and what value it brings. And finally, I just wanted to touch on that there is a growing wider profile around this work nationally. So as the slide briefly highlights, BLACHIR has been referenced in wider national discussions, including a report from the Institute of Health Equity on structural racism, ethnicity and health inequalities. And there's also been external recognition through awards linked to leadership and practice connected with BLACHIR. So this evaluation was commissioned not because we were uncertain on whether or not BLACHIR mattered to us, but whether or not it was the right time to step back, have a bit of a reflective time and say what difference has been made, what still needs to change and what should happen next to make sure that momentum isn't lost. So before commissioning the evaluation, we also wanted to make sure that the scope was shaped properly. So to do this, we held kind of 4 co-production workshop sessions, including ICS partners through the ICS task force, public health colleague involvement and community organisation input. And those sessions helped us define not just what the evaluation should assess, but what all the different stakeholders felt actually mattered to get out of this evaluation. And I won't read through all of them just in the nature of time, but there was a few themes that came through pretty strongly. So people really wanted there to be a distinction around BLACHIR's role as an approach and a platform for change, and not looking at as an accountability of individual partners delivering within their own organisations, and strong emphasis needed on that institutional change, senior leadership and the wider systems to engage with this work. There was something also around measuring change and making sure that we could define what that would look like. And finally was around showing progress and wanted to kind of highlight some of the success stories and testimonials, not as a substitute for the evidence, but as part of understanding how change is experienced and felt on the ground. And important to acknowledge that system change is still ongoing and that we need to both reflect on the progress that's been made and celebrate that, and also still look forward to the work to do. So my final slide before handing over to Equalital is the evaluation itself. So as I briefly mentioned, the overall research aim of this evaluation was to evaluate the effectiveness of the BLACHIR approach in facilitating purposeful and ongoing systemic change to reduce health inequalities and improve outcomes for the target communities. And we did make a deliberate choice to commission this as an independent academic evaluation. And there were several reasons for this rationale. So first, that independence helps remove any potential bias. If we had evaluated our own programme independently, there's always going to be a risk, or at least a perception, that those findings might be shaped by our institutional interests, the existing relationships we have, and a desire to want to present the work entirely positively. Second, an external team provides that more neutral vantage point to observe the landscape, and it matters for when we're not only trying to understand what happened, but how different stakeholders perceive BLACHIR, where some of the tensions sit, where there's genuine barriers that remain. And third, and quite importantly, an independent team can support more open and honest engagement from stakeholders. So people might be more willing to speak candidly to external evaluators about what has worked, what hasn't worked, where trust exists, and where we might still need to build on. So we hoped that this approach would ensure that credibility, transparency in answering an important public health question for us. So without further ado, I will hand over now to Sarah and Victor to talk us through the evaluation findings. So a little bit about the approach, what they found, and what is that telling us about BLACHIR. So thank you. And Sarah and Victor, please take over.
Thank you, Jordan. Yeah, so hi everyone, I'm Sarah, and I'm also joined by Victor on the call. And Jordan, do you mind doing the next slide? There we go. And so this is the team. So we work for a consultancy called Equalital, and we were founded by Jess, and ultimately we're a group of organisational psychologists. So we come from a research background, and our focus is bringing evidence-based approaches into organisations. So one of the strengths that we had on this project, we think, is that we all came into it with different experiences and perspectives, which has really helped us to look at this from multiple angles, because this wasn't a straight before and after measure. This was very much taking a systemic lens, and it was a very complex project with lots and lots of stakeholders involved. So alongside designing and delivering evidence-based programmes, we also evaluate a wide range of initiatives, and our approach is to understand what actually works, what impact they're having, and we've done this across both public and private sectors previously. So I'm going to talk to you now, as Jordan said, a little bit about the findings and the methodology, and you'll be hearing from myself and Victor today, but we're supported by the wider project team, which is our founder Jess, our academic advisor Luke, and our project manager Lisa. And the first thing to highlight is that before deciding how we were going to evaluate this particular programme, we needed to be clear on exactly what we were trying to learn. So when we first looked at this very unique project, we were presented with a large number of questions. So a bit like Jordan spoke about on the last couple of slides, there are a huge amount of questions, requirements, and also areas of interest from multiple stakeholders. So our first task was to bring all of those together and identify the core aims and hypotheses for the evaluation. And this gave us a clear framework for the work and helped us to therefore decide on the most appropriate methodology. So on the screen, again, I won't read them out to you, but these were the 4 key questions that we were looking at addressing. And then in terms of the methodology, this was a systems change evaluation, which meant that we needed a methodology that could capture that complexity and influence and impact across the different levels of the system. One thing that made this particular project unique was that BLACHIR was developed organically over time. So as a result, there wasn't a traditional baseline data set that we could use to measure that change against. And to address this, we designed a mixed method evaluation that combined interviews, focus groups, surveys, documentary analysis, and case study analysis evaluation. And this allowed us to build a rich picture of both the programme's approach and also its impact. So the evaluation was carried out in 2 phases. Phase 1 very much focused on understanding BLACHIR's role within the wider system, including barriers and enablers that shaped its work and influence. So all those questions about what was BLACHIR, what is the approach and how is that working and what progress is it making, those were within phase 1. And then phase 2 focused on a number of action cases, as we called them, or case studies that emerged from and were directly linked to BLACHIR. So these case studies enabled us to explore how change was happening in practice and assess the impact across systems, organisations and communities. So in essence, we took a 2-pronged methodological approach, first understanding the system and BLACHIR's place within it, and then examining specific examples of action and change so that we could then understand the impact that BLACHIR was having. And I want to go into enough detail on this methodology, but not so much that we're here for sort of 3 days talking about it. But what's really important to note is that for phase 1, we wanted to understand not just what was changing, but what was enabling or blocking change across the system. And to do this, we needed to look at system change with a system change lens and look at system change research to explore the factors that were helping or hindering progress within BLACHIR. So we drew on the work of Carnier, Kramer and Senge from 2018, who described changes happening across 3 interconnected levels when it comes to systems thinking. The individual level focuses on things like people's skills, experiences, knowledge and motivations. The rational level, which focuses on things such as the quality of relationships, collaboration, influence and trust between individuals and organisations, and the structural level, which considers the wider systems and processes that shape behaviour, including leadership, governance, things like resources, policies and organisational practices. So using this framework was really a really great way of giving us a clear way to explore the nuances and detail of how BLACHIR was operating within the system. And it actually informed the design of our interviews and questionnaires, helping us gather the evidence across all of those levels. And another really key point, I think, to land here is that we wanted to understand how barriers and enablers across those 3 sections changed over time. So not just what they looked like at a single moment, because obviously the BLACHIR project spanned over many years. And so it would have been too basic to have looked at this from a single point in time. So for each of the 3 levels, the individual, relational and structural, we asked questions about the barriers people were experiencing and the factors that were enabling progress, adapting those questions to reflect the different stages of BLACHIR development. So this distinctive feature of the evaluation was its time points. So on the screen there, you can see the time points that we split it into. And rather than looking at it as a single programme, so a before and after measure, we organised phase 1 around 4 key milestones in its journey. So that allowed us to explore how experiences, opportunities and challenges evolved as BLACHIR moved from review publication through governance and implementation, and then into scaling and the wider system influence. So this approach helped us really in 2 ways. First, it helped us enable it helped us to group stakeholders according to the stages and activities that they were most closely involved with. But secondly, it also allowed us to tailor our questions so that they were directly relevant to the specific time points in BLACHIR's development, so that they could be clear on the points at which they were reflecting on. And as a result, that really helped us to build a much richer picture of how change unfolded over time and across the wider system. Okay, so I'm going to hand over to Victor just to start us talking about the results and what did we actually find.
Hi, Sarah, thank you so much. My name is Victor. I'm going to touch briefly at a very high theme level what some of the key findings were. So looking at the visual, we found that BLACHIR was really much a change infrastructure. It created the key tools needed to drive change and to really tackle health issues across all these different communities. So the strongest forming factors that came through was how BLACHIR allowed more visibility of health inequalities, but it also allowed people to work across multiple systems, but it also allowed community leaders to really contribute on a very high level, which I think historically is something that wasn't really done enough across public health. And the final key theme that really came through was that BLACHIR allowed for relationship building across multiple public health systems. So what we've found across all the multiple stakeholders interviews and focus groups was that a lot of the change around BLACHIR were really found across individual and the relational level. What this means is that factors like motivation, empowerment was really effective consistently across all those multiple BLACHIR time points. However, looking at the structural level, we found that a lot of themes like accountability were partially present. What this means is that BLACHIR had some of these aspects across some of the systems. However, most of these factors were not consistently present across all the different public health sectors and stakeholders. Another key finding that came through, which I think is quite important to highlight, is the dependent factors. So not all of the factors had the same level of impact. We found that factors like passion were very much effective in driving people forward, engaging people. However, without tools like resources, training, having the right support systems, having that passion could lead to things like stress, burnout, and also anxieties. So dependence were very much linked to how well the specific context provided things like resources, training, and tools. Without those key structural factors, we saw that things like passion and engagement really led to more problems. And looking at the key barriers of BLACHIR, we found 2 main factors that were consistently present whenever there were key challenges. And these key barriers were things like competing demands. So a key example that I can think of was when BLACHIR's key objectives were not completely in alignment with a specific organizational culture. What we consistently found that was without the key alignment across multiple stakeholder systems, we saw that the progress of BLACHIR was very much limited. So the key takeaway across BLACHIR from our main findings was that in order to drive BLACHIR forward, there have to be a lot more investment across the structural factors, which has to be implemented consistently across all the key stakeholders. And there also have to be consideration around the context. For example, as I just mentioned, not every key factor is going to have the same impact. Understanding that factors are very much influenced by the specific context, that can allow BLACHIR to sustain its influence over a longer period of time. And one key factor that we couldn't identify across our multiple stakeholders interviews was that most of the individuals were very much unclear around how BLACHIR was structured. So another key recommendation was providing some type of onboarding training, which would then allow people to have clarity around who is where to go in case they need more support, where to find the key information, or just having a general high level understanding of how the system works. So is the system changing? Our main finding was yes, but the change was very much inconsistent across the public health system. So the key signals of positive change was that people were a lot more confident and also open about talking about racial inequality. We also saw that there were more visible ownership of things like responsibilities, who is responsible of driving change forward, of tackling key issues around public health and also health inequalities across multiple communities. We saw that there have been an increased investment across training, in particularly around cultural humility, cultural intelligence, and that were all key signs that BLACHIR was having a systemic influence across the entire public health system. Another key finding was that we saw increased accountability, such as there's been more embedding of BLACHIR principles into contracts. So whenever they were, how should I say, whenever there were key stakeholders who were involved with the BLACHIR project, they were being held accountable to share how they've been using BLACHIR key principles to drive change forward. However, on the flip side of it, we also saw that not all of these principles, not all of these key signals were being implemented consistently across all organizations. For example, engagement with some of the local NHS trusts varied, and this was a key theme that came up again and again, and this was a significant barrier. And as a result of that, accountability were also quite unclear. So going back to my previous slide, we saw that accountability, structural factors were the key areas whereby we think BLACHIR can still make significant progress in. We saw that when looking at specific projects, that things like accountability were not consistently present across all the various stakeholders, organizations. And reliance on key individuals links back to the previous slide where I discussed about dependent factors like motivation and skills. One key theme that came through across all our key stakeholders is that BLACHIR progress was very much linked to having the right people in the right places. And these people tend to have motivation and the right skill set. They were very much passionate about BLACHIR. However, as to my previous point, without the right context, without that structural elements such as having the right tools, resources, onboarding, leadership support, this can easily spill over into things like stress and burnout. So taking all that into consideration, again, yes, BLACHIR has been having a huge influence, has been changing the system, but we think that taking into consideration a lot more of the structural factors which are still underdeveloped as of present will allow BLACHIR to sustain its influence for a much longer period of time, while also taking into consideration that different contexts can have different influence on specific individual. So looking at both the structural factors, but also the context are key areas where BLACHIR can still make significant progress in. I will hand it over to Sarah.
Thanks, Victor. So across all of the evidence that we collected, the same 5 conditions repeatedly emerged as foundations of successful change. And when we looked across both phases of the evaluation, we found that projects achieving the strongest outcomes also tended to have 5 factors in place. So the first was leadership, commitment and resources. So where leaders actively championed the work and organisations invested the necessary time, funding and capacity, implementation was typically stronger and more sustainable. The second was data and insight. So access to good quality data helped organisations better understand needs, target interventions more effectively, make informed decisions and learn from progress over time. Third was strategy and accountability, and projects were more successful when there was a clear sense of ownership, defined responsibilities and mechanisms for tracking progress and maintaining momentum. So a lot about what Victor was talking about there. The fourth condition was co-production and learning. So some of the strongest examples of impact came from genuine partnerships with communities where solutions were developed collaboratively and organisations were willing to learn and adapt along the way. And finally, stakeholder capability and alignment played an important role. So successful projects brought together people who had the skills, motivation and flexibility to respond to local needs whilst working towards that shared goal of BLACHIR. So together, these 5 conditions provided a practical framework for understanding what enables system change initiatives like BLACHIR, but also others potentially, to succeed and where future effort and investment is likely to have the greatest impact. And then on the screen here, although it'll be very, very tiny, in terms of the future, and so you have all of this, but this is part of a much, much bigger report that you can look at more detail in. But I wanted to put this up on the screen because in terms of the future, this final slide of my slide is about a clear framework for sustained implementation. So here we've identified realistic and measurable objectives over a 10-year process and identifies some successful benchmarks using the BLACHIR approach. So this whole framework was informed by the 5 conditions that I just talked about through for progress that was identified through this evaluation, evidence from system change research, and the general guiding principles are sort of threefold. So you've got one is to strengthen enabling infrastructure. So BLACHIR's primary role is to provide the infrastructure that enables change, and the framework here therefore focuses on building and strengthening system capacity rather than prescribing specific programs or interventions. The second guiding principle is to prioritize structural embedding. So again, a lot about what Victor talked about with the findings was that we need to show structural conditions are they are the least developed at the moment part of the system. So as a result, this framework highlights and prioritises embedding BLACHIR within organisational and system structures to support that long-term impact. And the final guiding principle was to ensure sustained and equitable change. So sustainable change requires the responsibility for implementation to be shared fairly across partners and stakeholders. And the framework therefore incorporates well-being, equity, and workforce sustainability as a core implementation consideration. So together, those guiding principles that have come directly from the result of this independent evaluation provides a foundation for delivering measurable progress, supporting the long-term system change, and creating the conditions for sustainable health equity outcomes. Okay, so I'm going to hand back over to Jordan to round off the presentation.
Thanks, Sarah, and thanks, Victor.
Thank you.
And thanks for all the kind of the work that's gone into this evaluation so far. And for some of those that are on the call that I can see that have been involved in BLACHIR, it's been brilliant to see from this evaluation that there is such a ongoing commitment from such dedicated individuals, and it's brilliant to see that there is change that's being made and that this is having an impact, because ultimately we all have that shared priority of making Birmingham a better place for our residents. So I think it is really useful to have this, to be able to reflect back on how do we push for that real kind of structural change from a leadership point of view, and from changing some of those system norms, using the momentum and the work we've got to date to really make this kind of a lasting impact and make some of the programs of work just part of how we work rather than as a kind of a standalone BLACHIR intervention. So I really wanted to now transition from kind of what the evaluation said to what do we take forward, how do we take that forward, and how do we, say, embed that. So some of the things that I'm going to briefly highlight is that some of the work, now this is obviously just a snapshot again of the work going on for BLACHIR. This is just from the council's point of view. There is equal amounts of priorities from each of our ICS partners and kind of community organisations supporting this. But just to show how we are as the local authority transitioning some of those pieces of work that have a good evidence base behind them into kind of ingrained ways that we work. So one of which is the BLACHIR Better Data programme. So we did a piece of work with 325 plus residents, stakeholders and community organisations to look at how council services collect demographic data in a way that's going to be reflective of our service need and help stop some of that data invisibility. So we've established now, we've got the new demographic standard, and we've got a cross-directorate working group to embed that across all of our council services, and we aim that kind of from the beginning of next year that this will be used across every single one of the council services. And there's also some ICS services piloting the tool as well. So we're looking at working with the cancer bus tours to look at how ethnicity is captured to be more reflective. There's also, like I mentioned, the culture, humility and safety training package. So this was taken to one of our adult social care and health scrutiny committees a couple of months back, and some of the members that sat on there wrote a letter to the managing director to endorse rollout of this training to our senior leaders and our councillors. And the end goal for this is that something like culture, humility and safety would be part of standard onboarding for council staff, and ideally kind of all healthcare wider kind of ICS staff as well, to really kind of break down some of those, how to have culturally humble approaches to the work. Again, kind of an expansion of BSIF. So all of these programs work. If you don't have a background on them, by the way, you can find out the specifics on the web pages. But BSIF was looking at how to plan and understand service users from kind of specific communities that might have individual needs that we need to support through service planning, design and commissioning. And then also there is now a communities partnership that was a direct evolution from the BLACHIR implementation board that now reports directly to the Health and Wellbeing Board, and has that strategic responsibility to ensure that communities of identity are suitably represented in strategic decision making across the council. There is also a need as well to kind of embed the BLACHIR approach into wider systems of work and to make sure that there's a really joined up approach across the council, as you've probably, or across the system really, as you've probably noticed from the presentation. The main approach of BLACHIR so far has been solely a health lens, and is kind of sat primarily either within the different ICS trusts or the public health division. So there's a real need to kind of expand that across a wider kind of variety of sectors. So one of the kind of clearest examples that we've got of that wider embedding recording is Birmingham's recently launched partnership with University College London's Institute of Health Equity to become a marketplace. And again, for those that don't know what it is, there should be a link there. So as part of that work, Birmingham has selected at least two of these marmot principles as areas of focus, including one around tackling racism, discrimination and their outcomes. And the learnings from BLACHIR, particularly around racial inequality, community partnership and anti-racist systems thinking, will directly inform the shape of this wider work over the coming years. So even where the BLACHIR name may not always have foreground in every future programme, the influence very much remains present in the background. And in that sense, BLACHIR then becomes wider and not just a programme title, but part of the city's longer term infrastructure for anti-racist practice and health equity. There is the official launch for the kind of the marketplace work next Tuesday at Aston University. I think there is currently a waiting list / a very small amount of tickets left. So if anyone is interested, the sign up link will be there as well. And a second example of that is the legacy in the development currently ongoing of a Beyond Racism partnership. So as the slide quotes, one of the council's main statements from their city vision is that by 2035, they want Birmingham to be the best city in Europe for young people and a world-leading anti-racist city in recognition of its youth and diversity. So it's an ambitious statement, and achieving it requires structures, partnerships and ways of working that can move anti-racist practice from principle into delivery. And again, this piece of work, once it's in its fruition, will help transition BLACHIR out from just that kind of health lens into wider, what does anti-racism look like from potentially a cohesion or a safety or a housing, etc. point of view. So there's currently developing a short-lived kind of task and finish group to understand what that's going to look like and help create and co-create that wider whole systems agenda. And the intended membership, again, is supposed to be broad and cross-sector and going beyond those health inequalities to address systemic racism a bit more holistically. So again, while these programs may have broader remits, BLACHIR's core learning are still going to remain visible from within them. And now also to briefly talk on how BLACHIR is being evolved within the health system itself, is within kind of the BLACHIR ICS task force. So for the next kind of 5 minutes or so, I'm going to quickly hand over to Tanya to talk us through before we can then move into wrapping up and the Q&A section. So over to you, Tanya.
Thank you. Can you hear me, Jordan? Thanks, Jordan. I'm Tanya Sikabofori. As Jordan has said, I'm the BLACHIR task force chair. I'm going to briefly talk through the role of BLACHIR ICS or ICB task force, where we're now and what comes next. As chair, the task force, what I'm really proud of is that this has become a genuine, as said earlier, and I'm pleased that the evaluators have said that, a genuine system-wide collaboration, bringing together partners across the ICS to focus on tackling health inequalities affecting Black communities. Do you want to move the slide, please? Thank you. So just to take you through where we are, through to at least 20, or firstly, the task force has now received an approval to continue through to at least 2027 with dedicated leadership and project management with Fahana in place. That's really important because it gives this work stability and longevity, as highlighted by Jordan earlier. But secondly, we've also received the independent evaluation, which we've listened to, and what we're doing is actively using those findings to shape how we move forward. So this isn't just something we have just received, it's something that is directly informing our next phase. So right now we're in place or in phase of refreshing our objectives. This includes strengthening alignment with the original opportunities for action, increasing collaboration across all organizations, and really focusing on making this business as usual rather than a standalone project. We're also pulling together the progress from the last year to better understand impact and importantly, to shape learning across the system so we can avoid duplication, but also build on what works. Try and see. Oh, yes, next slide, please. Alongside the task force work, we also introduced the BLACHIR Community Engagement Fund. This is about supporting community-led action, particularly where organizations are working directly with the Black African Caribbean communities to improve outcomes. So what's important here is that this funding is focused on meaningful co-production, measurable impact and alignment with the system priorities. So it's not just activities, it's about real change that we're looking for here. The fund is also open to a wide range of partners, including the voluntary organizations, system partners, and community groups. But as long as they are working with Birmingham, Solihull, and Sandwell, then it's fine. In terms of the criteria, we're looking for clear alignment with BLACHIR priorities. We want also demonstrable benefit to Black communities and the ability to safely, effectively, or ineffectively deliver this work. So the funding is relatively modest. I think we have agreed up to about 5,000, but designed to enable focused impact or impactful interventions delivered within a short time frame. So I would strongly encourage colleagues here and those who are not here who would eventually listen to this and partners to consider applying or sharing the opportunity within the networks. Finally, overall, I think what's really encouraging is that we are seeing sustained commitment across the system, and it's a real shift towards embedding this work for a long term. There's still more for us to do, as the evaluators have told us, but the direction of travel is strong, and I am confident about the impact we can continue to make together. I'll hand over back to you, Jordan. Thank you.
Thank you, Tanya. And I will just kind of wrap up now on that, what's next and the call to action, but just kind of a quick reflection from the last couple of slides from Tanya and before that, that I think it's important that going forward, we really take on the recommendations from the evaluation to look at how we influence system change, but also while a lot of that is going on in the background, that we don't neglect the importance of advocating and championing kind of short-term kind of community needs. And I think this is kind of a great way of bridging those two ends of kind of the BLACHIR system together. So briefly just on kind of the direction of travel for BLACHIR. So there is now something around spreading BLACHIR, so making sure that this work is joined up across a wider geography. As some of you may be aware, the kind of the local ICS infrastructure in our kind of geography has recently opened up. So we've gone from the Birmingham and Solihull ICS to the Birmingham, Solihull and Black Country ICS. There's a great opportunity for kind of geography spreading and ensuring that the learning is not held too narrowly within one programme or one set of individuals. The second is around, that's come through really strongly from the evaluations, around embedding BLACHIR and moving away from exclusively that project-based mindset towards how do we then influence that longer term system change. And if BLACHIR remains something people think of as only a named project from a particular point in time, then I think we will have missed a major part of its value. And the goal is really for it to become principles, methods and expectations that become part of how the system works as a standard. And the third is hopefully establishing BLACHIR as that model for excellence. So as part of this, we also asked ICS task force members to imagine 5 years from now in terms of who will know about BLACHIR, what will they know, and what activities will we be driving. And the vision that came back was pretty clear, that BLACHIR would be a widely recognised, trusted system-wide partnership model for reducing inequalities. People would clearly see it as that model for excellence, and that it would be driving strategic system-level change rather than those isolated activities. So just briefly towards the kind of the end of this webinar, I just wanted to finish with a clear call to action for everyone that was with us today on kind of what you can take away from this webinar. So if you're joining from a local authority perspective, this is a real good opportunity to reflect on your own local approach to anti-racism and ask what learnings from BLACHIR can be applied within your own areas of work. And we absolutely would really welcome any conversations around shared learning, practical collaborations, and how this approach can support wider improvement across kind of national scale. And the contact details are at the end. For any kind of ICS system partners, if it's local, there's a clear invitation to get involved with the ICS task force if not already joined up, and to also just kind of join up that wider learning, share kind of the challenges openly, and strengthen those system-wide collaborations that we have. And for any community organisations on the webinar, there is obviously an invitation for both practical and strategic, so to apply for the BLACHIR Community Engagement Fund where relevant, and also to continue championing BLACHIR and the wider anti-racist work that I know so many people are continuing to do within their communities and partnerships. And underneath all of those asks is one clear shared message that BLACHIR only works if it remains collaborative and collective. Its strength has always come from partnership, having that challenge and the shared ownership, and that will remain true whatever form this work takes next going forward. And just before I move on to questions and the Q&A and wrapping up, I just wanted to take a moment to acknowledge everyone that's contributed to this work, just the evaluation, but also wider in BLACHIR. And that involves the Equalital research team for all of their hard work in coordinating this, all of the members of the BLACHIR ICS task force that got involved, the BLACHIR Deep Engagement Partner members, including Allies Network, Illyria Health and Mindsight Development, and all of the individuals from across the rest of the system who gave their time to this research, either through one-to-one interviews or focus group discussions. And evaluations like this are only possible because people are willing to reflect honestly, share their experiences, and invest their own time in shaping something bigger than any one organisation. So a big thank you to everyone who's contributed to this so far. So thank you very much, everyone. We'll now use the last couple of minutes to open up for any questions, either in the chat or for hands up. And while any questions come in as well, I'll just pop up the contacts and links on the final screen. So any kind of follow-up questions on BLACHIR's webinar, either to contact me directly or the BLACHIR inbox. And again, I've also put up details for the ICS task force, for Equalital, and through the Healthy Brum channels. So open up for any questions over the last couple of minutes. I appreciate that we're almost already up to time though. Michael, hi, are you all right? You're on mute.
Yeah, thanks very much. Thanks to Equalital for that. Just to say, I was particularly interested in the framework of the individual, the relational and the structural, and I was wondering if we made progress against each of these in equal measure, or in fact, is there an appropriate or a recommended order in which we should try to do each of those?
I can answer that. I don't mind. Hi, Michael. So according to the research, it shows that you want to be approaching all of them simultaneously as much as you can, because if you focus too much on one aspect, you might ignore the other. So one thing that we couldn't dive into as much right now on this session is that they are all related to each other. So for example, having that structural factors allow people to feel more driven, motivated, because they don't have to take on a lot of that stress. So there's that link between the structure and the individual level, but there's also that link around the relationship building as well. Whereas if you have the right things in place, it makes it easier for people to know who to contact and to build those relationships. So it's key to approach them all simultaneously as much as you can, if that helps.
Thanks, Victor, and thanks, Michael, for the question. Next hand is Paul.
Yeah, the question I was going to ask, across Birmingham and Lewisham, what is the top 1 or 2 ways that the Black and Afro-Caribbean community have benefited from BLACHIR so far?
I think that's a brilliant question, and it's much harder to put down on paper because a lot of kind of the work being done is kind of on that the back end. I think one thing that the evaluation really highlighted, that despite us not being able to say, okay, this health inequality has reduced by this amount across the board, which is a really complex thing to do, is that there has been a lot more kind of open conversations around anti-racism and anti-discrimination coming right from the top, that I think that there is a sense of being more heard and a bit more of kind of a community feel, despite that I know there's kind of a lot of external tensions going on at the minute, but having kind of strong things like BLACHIR in place and the anti-racism commitment to kind of really show that this is important and making people feel that there is a community to belong to as part of this work, I think has been really important. Hopefully that answers your question.
What I think in essence, say for example, some of the biggest things that affecting the Black and Afro-Caribbean community is respiratory health and cardiovascular disease health. So have those two things improved across Birmingham and Lewisham since BLACHIR started?
So I'll come in quickly, and then Tonya, I'll hand over to you. And again, in terms of being able to measure and say that it has improved, because BLACHIR has only been really in its intervention phase for kind of 4 years, it's really hard to show whether or not things like CVD has drastically improved. However, we can say that because of BLACHIR, that there has been a lot of work driven forward. So although it wasn't mentioned in this presentation, there was a piece of work done about a year ago in terms of investigating the NHS health check programme on in Birmingham that looks at cardiovascular risk factors. As I say, kind of a lot of that can disproportionately affect African and Caribbean communities. And from some of that research that we did with local groups, there is several strands of work on improving the NHS health check offer. So there is ongoing work with the Cities at Heart, kind of a European programme. We are currently looking at making sure that we can recommission old COVID roving vans to get out and do community-based CVD kind of health checks. I know that, although this is not my area, so I can't give full details, I know that our kind of Aging Well and Workplace Health team did like workplace interventions for CVD testing, and a lot of that kind of passion being driven forward came through the work that was driven through BLACHIR. So although we can't say what the end point is yet, there has definitely been an increase in appetite in some of those areas from kind of the work that was led from BLACHIR that's now being dispersed to the wider system. So BLACHIR led on kind of that research based on the kind of the findings from the review, and now it has gone wider than BLACHIR, and it is not the BLACHIR team leading on anymore, and it is now just the public health team that leads on the commissioning of that for all of Birmingham. Tonya, you had your hand up, but it's gone down. Do you still want to come in? If not, I'll let Victor come in there.
I think you said most of what I was going to say, Jordan. But also, I think what from a public health point of view, to actually see a measurable change, Paul, you need several number of years. 1, 2, you also need sustained funding of the things that we're doing. And I think finally, yes, BLACHIR is doing this work, but there are also many other organizations doing similar work to make the similar change. And I think, Paul, you're one of them with your, barbers project. You're going to barbershops. So everybody, I think the thing is making sure that this work that we're doing spreads, and that, So yeah, I don't want to repeat what Jordan has said, but
yeah, I will join in quickly on that as well, Paul, if you don't mind. From a research point of view, the evidence shows that one has to be consistent for a period of between 5 to 10 years in order to see actual visible change. So change is actually happening, but this change has to first take place within the system, which is then transferred over to the specific communities. So from our key findings, we can confirm that the change is consistent with what we would ideally want to see when it comes to systemic change and like reducing public health inequalities and so on. But the key factor now is that consistency, making sure, as Tonya has highlighted, making sure that resources are all in place and those structural factors are really embedded across the entire system consistently for at least a period of 5 to 10 years.
Okay, that's good. I appreciate you taking the time to all three of you to clarify things. I know these things to fully implement or even have small changes, all these things take time. So I appreciate you answering my question.
Thank you, Paul. And just on that as well, that's why I'm so committed to keeping BLACHIR as both a name and as a principle going, because so often we see, especially with things like racial health agendas, that they go kind of on and off, whether or not it's in vogue or not, to focus on it. And that to have that consistent kind of 10-year period on one thing to see that change, it's really important that I want to see that BLACHIR no longer kind of falls out of favour for something kind of newer and shinier, that it continues to be something that we can continue to build on and to gain that momentum. We've got such a kind of almost a brand within kind of the healthcare system now that we can build on to really get to the point that a lot of the projects that we've been working on for the last 2, 3, 4 years really start coming to fruition and making an impact, and don't just kind of get stopped and halted now right before we start seeing a lot of that longer term change, which is what we're really hoping for. Juliet, next hand, please.
Hi, can you hear me okay?
Yeah.
Yeah, it's kind of just a bit about what you've already said. I think you talked about the task force at the minute will continue to 2027, but you talked about it not being projects and moving to long term, and we've talked about that long term thing. So my question is, why is the task force only till that time, and what will happen if that doesn't continue? How will that have an impact on that long-term effect that you've just been talking about?
Thank you. I think I'll let Tonya take this one first.
No, thank you. I think it's difficult to answer that. There are lots of changes. There's financial difficulties, there's demands and all that. The task force was kept till the end of this, no, till the end of this last year's, is it this year's April, May? And we recognize that some of the work we've done, apart from just embedding and the learning, we felt that there was need for us to spread this to other things. So with all the changes in the ICS and ICB, as we all know, the ICB agreed to commit to an extra year, which I think we need to be grateful for, you know, with all the challenges that they have. I think we have to, within this year, up to 2027, look at what we evolve to. And as Jordan has said, it's about the branding, it's about the learning, it's about making sure that whatever it turns out into, that we continue the work that we are, because there's still a lot for us to do. And from a public health point of view, as Victor said, you need 7 to 10 years. I mean, Victor said 5, but you know, I'm a public health physician too, and I know we're told, you know, to see any even minimal change in some of those data, you need about 7 to 10 years, and so we just have to keep going, really. I don't know if it answered your question, but as you know, all these things has to come down to money, and it's not easy pushing to get the money.
I'll just come on the back of that as well real quick, that I think it's important to just
Thank
note
you.
what Tonya said in a bit more detail, that the ICS task force was already supposed to finish in 2 months ago, and that because of the joint efforts of everyone in the task force being committed to it, we tried to use this evaluation as well to kind of help push forward to show that there's still a real need and an evidence for it. And the ICS did already listen to us once and kind of continued that appreciation, so we're kind of hoping that it will be able to do the same. But even if we get to kind of this time next year and there isn't that same approval from the ICS, it won't be the end of kind of the task force in any way, shape or form. That there's already been several changes. So there used to be within the council a BLACHIR implementation board that specifically met every other month to look at ongoing progress. So even though that doesn't exist anymore, so there's the evolution. We now have kind of a wider community partnership. There's still an internal group. So despite names changing or kind of people changing, there's still some sort of continued journey throughout the system. That's really what we're looking at, that instead of things having set names or set places, that as long as there is a continuing thread throughout all of it, that we'll still be able to achieve what we need to. Hopefully that answers and give some reflections as well. Thank you. Right, I can't see any more hands, and I appreciate that people have already stayed in 10 minutes past the end time, so thank you so much. What I will do is just wrap up real quickly and turn off the recording for if there's any final questions that wish to not be on the live recording as well. But just for the purpose of kind of formally closing, thank you everyone for joining us today. Thank you for your interest in the work and for continuing to support this wider journey towards kind of an anti-racist practice, system change and improved outcomes for people that live in this city. So I'll turn the recording off now for any further questions.